I just want to welcome everyone here today to the presentation on neurodivergence through the female lens. Abby and I are really excited to get to spend the time with you today and appreciate that you're here and interested in inclusion and looking at this from that female perspective. We have a pretty full agenda. We are going to spend a little bit of time getting to know one another. And then we're going to talk a little bit about why is it important to even consider neurodiversity through that female lens. We'll then go into 3 different types of neurodiversity and what the research says about them through that female lens: ADHD, autism, and dyslexia. And then we'll do a wrap-up exercise. Please feel free to put your questions and thoughts in chat throughout the entire session. We really want this to feel very interactive, and so don't hesitate. We were going to do a Mentimeter to get to know you, but we're a small group, and I think we don't need to do anything quite so fancy. So I am just going to ask everyone, maybe go around and tell us what your primary role is related to your participation today. And then if there is, one word or short statement that sort of indicates what it is that drew you to this session. And you're welcome to put it in chat if you don't want to say it out loud, whatever works for you. I see no one necessarily raising their hand right away. If you all want to just put that in the chat, that's great. Looks like I see some people typing.
I can go. I'd rather speak than type.
Awesome.
My name is Sandra Gonzalez. I'm from the Franklin McKinley School District. I am a program specialist. I chose this to go to this talk today because I'm just really interested in the I know a lot of girls get misdiagnosed or just overlooked because it doesn't look the same as with the boys. Girls are very internal. I'm just really interested in that. I've dealt with middle school girls a lot also. And so I just wanted to learn more. Yeah.
Thank you so much for coming. And I see Melissa comment in the chat, and Tristan, is it Tristan? Has her hand up, their hand up.
Hi, I'm Tristan. I'm an education specialist. I do K through 5 at my Palo Alto Unified School District. I chose this because, just like what someone else just said, like I have a student on my caseload that I feel like this will give me a lot of good insight to how to support her. She's not officially diagnosed with autism, but she shows a lot of markers, and it's parents are wanting some type of support, and we're just kind of in a gray area right now. So I'm hopeful that this will kind of give me some more support in how to help parents and help her in the school.
Awesome. That warms my heart. Thank you for sharing that. Marcia or Tina, if you want to weigh in at any point, feel free. Otherwise, I think we'll keep going, but know that we're wanting to hear from you all throughout the presentation. So please don't hesitate to let us know. So a little bit about who we are. I'm going to introduce myself. I think it's just important that you know the angle that we're coming to this work from, and sort of our positionality in the work is that I am the mom of 3 teens, one of whom is an autistic girl. And I have a 19-year-old and twin 17-year-olds, and we suspect that my 19-year-old trans daughter, now we suspect she may also be autistic. Because of having an autistic daughter who was diagnosed at 12 and a half, I really wanted to do work to help better understand these kids. And so I started a nonprofit called REAL that's based out of the Silicon Valley area. And in that work, I'm really drawing on a 15-year career working on educator professional development and growth. So I'm a real big believer in supporting our educators in the important work that they do. Also a doctoral student at the Bridges Graduate School of Cognitive Diversity and Education, where I am doing my dissertation on autism through the female lens. Abby, do you want to introduce yourself, or do you want me to introduce you?
Hi, everyone. I'm Abby Kirigin. So I am the executive director at REAL, which the organization that Callie co-founded. We met 2 or 3 years ago now, as doctoral students. So I'm also pursuing my doctoral candidacy in education. My focus is slightly different. I'm working on strength-based approaches for helping middle school students know their passions and interests. But I also have 3 children, 2 of whom are twice exceptional, and one of them is female. And so a lot of this work came out of a project that actually Callie and I did with another colleague of ours, Katie Coder, where we were all looking at different neurodiversities and how they present differently through the female lens.
Yeah, thank you. So we are, as I said, part of a nonprofit in the Bay Area called REAL. We really do strive to ensure that our twice exceptional students are thriving in school by focusing on parent and educator awareness and understanding through a variety of resources, tools, events, and services. If you're not familiar with twice exceptionality, it's the concept that you are neurodivergent and also have really incredibly strong strengths that sometimes mask each other and make it very hard to untangle what is really going on with a student. It's not obvious. Is the student really just advanced in some ways? Is the student really just struggling in some ways? They're always sort of living in this ground where they're just very confusing, and that can lead to a great deal of misunderstanding and misdiagnosis. So that is the group that we are with. I keep trying to forward, but Abby has control of the PowerPoint. So if you hear beeping, it's because I'm like, forward. We already mentioned that we are graduate students at the Bridges Graduate School, and this work did come out of a class on neurodiversity in the classroom that's taught by Dr. Thomas Armstrong, who's a leading thinker and author on neurodiversity. These are a couple of the books that we used in his class, The Power of Neurodiversity and Neurodiversity in the Classroom. I will say, I think these are not 100% like the greatest books now, because they're 10 to 12 years old, and they're still very good, but there are probably more up-to-date books. But I did want to introduce you to Thomas Armstrong if you're not familiar with him. And then we use a definition of neurodiversity that I think it's just important we're all on the same page about, that it's this umbrella term that really is recognizing and embracing the natural variations in human brains and the way they function. So we really are not looking at disabilities through a medical model, but through a neurodiversity lens as well, because it really is describing this idea that people experience and interact with the world in many different ways. And so the more we can look at them as all that they bring to the table and not as broken, the better. So why look at this through the female lens? And I think actually Sandra, I think, brought up that it's not just necessarily female, but internalizing. So primarily the experiences we're going to talk about today are about research that has been come out of looking at females who have experience different neurodivergences, but we're coming to understand that this can be expressed across genders as an internalizing presentation, and we can learn a lot about internalizing presentation by looking at the female experience, especially given the overlap of gender fluidity in our neurodivergent community. It's important to understand that these experiences aren't just for females, but primarily that's the way we learn about them. And there are some really common experiences across the different neurodivergences we're going to talk about today. The first is masking. It's that females tend to mask, they're camouflaging. So they're artificially performing social behavior because they are learning more about what is socially acceptable by those neurotypical standards, and they may be hiding behavior that isn't socially acceptable. People tend to have different behavioral standards for girls than for boys, and girls pick up on that and try to learn and try to just kind of blend in. That subtle presentation, though, can lead to burnout, stress, anxiety, panic attacks, and trauma. We also have a lot of misdiagnosis because there's so much bias in our diagnostic standards, weighted towards more typically male presentation. So it takes longer for these girls to understand themselves and find out who they really are. Because of that, then they're really missing out on early intervention services and supports. And that's a big risk factor from them down the line. So, you really, especially let's say like Abby will cover this in dyslexia, if you're missed out, we know those early intervention services are so important for our dyslexic students. And all this really leads to that misunderstanding, that anxiety, more sensitivity, more friendship difficulties, just all these things that are really hard on our neurodivergent females. And another important reason on the next slide is that women and girls have rarely been studied in medicine and psychology. This has really changed in the last 5 years, I would say. We see an increasing interest in looking at the female experience, but for decades and decades, girls were not studied. And so we did not understand the full range of presentation for these learning differences. So we really hypothesize that these girls are underidentified and underserved. And this is so important, not just for school, but for their lives, because if we think about neurodiversity in the workplace, we really love this quote from Ruth Bader Ginsburg that says, women belong in all the places where decisions are being made. And it shouldn't be that women are the exception to being included. And it shouldn't be that there's just one or two. So we really want to find ways to help these young women get the skills they need and live the dreams that they want to live so that they can go into the workplace and not face discrimination, harassment, lower compensation, or unrealistic communication expectations. And this applies to all women, even those who are not neurodivergent. So we do come from a place of really wanting to see all women succeed. So that's where we're starting from. If you have any questions or thoughts about that, please feel free to add that to the chat. And I'm going to dive into the section we're doing on looking at the overlap between being female and having ADHD. So we know in research that's been conducted by a wide range of people, but in particular Malum and colleagues, that there are more males than females that are diagnosed with ADHD in childhood at a ratio of about 2 to 2.5 times more males than females. This actually starts to even out as we look into adulthood and we find more women seeking help for different challenges they've had, that ratio is more like 1.5 to 1 or even lower. So there's just a tendency for females to be diagnosed much later in life. And we've talked a little bit about the next slide about why is there this discrepancy? And probably because you all work in the areas where you work, you know that there are 3 types of ADHD. There's the hyperactive type, the inattentive type, and the combined type. So the hyperactive type shows more externalizing behaviors and tends to be what people first see in the classroom when we're trying to get students to work with us and work with themselves and learn and grow. The inattentive type, it can be a little spacier, a little more dreamy. It's a little easier to overlook when we're, really just trying to get everybody going on the same page. And then of course there's the combined type. You can have both of these. And really one of the biggest research reasons that people say there's that observed sex difference in referral and diagnosis is that girls tend to present with that predominantly inattentive type. So they tend to be less disruptive, more daydreamy. And so it can also look like anxiety or depression. And sometimes that's what's first being diagnosed in our ADHD girls. And that's when we start to realize something is going on. Boys and men tend towards that hyperactivity and impulsivity, but a lot of times the hyperactivity sort of evens out as they get older, but that inattentiveness is more likely to continue. And so that's when a lot of women start to realize, like, this isn't just something that happened to me in school. This is my life. But we do want to just note again that this isn't always universally true. I mean, there are girls who have the hyperactive type of ADHD. There are boys who are also being missed because they have the inattentive type. So it's just, making sure that we don't take it as a stereotype that it's always going to be this way. So again, why we have this discrepancy is that, again, that research focused on male subjects. There's that gender bias in the DSM-5. There are the co-occurring challenges that we see. So, you know, they tend to have ADHD will have the anxiety and the depression, and so that gets masked. Some of those things are getting masked. You also might see more substance abuse, bipolar, psychiatric conditions. These things can cloud our understanding of what's happening with the ADHD. Of course, we know about the masking and compensatory strategies, and then there is a referral and a rating bias among teachers, parents, and clinicians. Everyone who's looking at the girl will be less likely to refer her in their ratings. She'll have to be really acting out to get the rating that she would need. So that's just something we need to really be aware of, is that there's a bias, not just in the criteria, but in the way we're seeing these young ladies. But ADHD, like, it's really this idea that there are two sides of the same coin. On the one hand, you know, we know that with ADHD, you could be inattentive, and so people might see you as distracted. And then when that combines with your hyperactive, fidgety nature, you're seen as impatient. You're seen as having low impulse control and self-control. You're procrastinating, you're loud, and you hate being bored. And that tends to be the kinds of behaviors we're looking for. Those are the externalizing behaviors that we can see. But on the other side of the coin, you can be that dreamer who's just inattentive. You can be energetic, but not fidgety, and that can make you a real go-getter. You can be someone who uses your impulsivity more towards positive risk-taking, being willing to try something new or see something really in a different way that no one else has seen before, which can make you an idea machine. You can be very enthusiastic, and that can make you super fun-loving. So we want to make sure we understand that ADHD has parts that can be really difficult, especially in certain environments. But if we flip that coin, there are lots of ways that we can leverage ADHD towards someone's strengths, and that these may be the ways that girls in particular are being seen. So we've talked some about the challenges that you might see with a young woman or a girl who has ADHD, that daydreaminess, like sometimes people may just think they're not paying attention. And so that's a problem, but not always as big a problem as the kid who just won't sit still in their seat, right? Sometimes they'll be missing small details. They might be someone who can talk to you and go into great detail when they're talking to you, but then when they're actually doing their work, they're missing those details, which can be a little confusing. Sometimes they're impatient because they just have so much energy and they want to use it for their ideas. They can struggle to follow directions. Sometimes they have organization problems. They can just be forgetful. They might interrupt other people because of their impatience to talk about their ideas. They can get more easily emotionally dysregulated and just really talk a lot. I should go back to that. Well, I'll talk about this in the context of this lovely graphic from Danny Donovan, who does ADHD comics on Twitter or X. And, you know, I just love this graphic because it's like, my sister definitely has ADHD, and this is exactly what it's like to listen to a story from her. It goes many different directions and it comes back around, and an hour later, you're like, that was a good story, you know. But examples for how that can be challenging once the girls are moving out into the workplace is that interrupting can create a social barrier between colleagues and can frustrate, you know, when you're collaborating with an ADHD female. So it's important for us to think about, in the school and in the workplace, how can we start helping ADHD girls have a workplace mentor that can really coach and give them strategies and discussion strategies and collaboration strategies. And then when you have to follow directions, if you need like a very specific information for a project or timeline, you know, a person that's ADHD might have the big picture for the project they're working on in school or in the workplace, but then they might not recall all the different specific instructions for every single layered detail. So they just need to make sure that they know who they are so they can ask for accommodations, like those directions really written out clearly, and things they can refer back to make sure they're meeting the goals of whatever the project at school or at work might be. And I really love this quote from Morley and Terrell, just from this year, a study on ADHD in girls. It really highlights that early identification is so important, because we really need to give girls access to that support they need so they can develop that positive sense of self. Otherwise, they're just going into school and work thinking, I'm not good with details, or I can't do this project. But really, if they could just have that support, they can contribute all of the positive things that they have. In fact, studies show that if they're being seen for their struggles because of less hyperactivity and those bias ratings, then that actually is increasing the stress and pressure on them, because they're not being seen for their ADHD and everyone's expecting them to perform in a certain way. It's even more stressful and a lot of pressure. And research suggests that early identification and treatment for ADHD has actually a protective effect on the future development of depression, bipolar disorder, and substance use. So it's really important, because if there was a study that showed that children who received that kind of treatment, they had unemployment rates that were 3 times lower than individuals who did not receive any treatment for their ADHD in children. So it's just really imperative that we start identifying and supporting girls earlier than we currently are. Otherwise, we see serious risks. We see there's a lot of female stigma that's related to their social and interpersonal skills, because like I said before, we're expecting girls to show up in a certain way. And when they don't, then there's additional stigma. And of course, that's compounded if they're coming from a culturally, linguistically, or economically diverse background. It's just layer upon layer in how we expect the social and interpersonal skills to show up. We've talked about that low self-esteem. It also puts them at risk in their relationships. They are at greater risk for partner violence, for taking risky sexual behaviors, and actually for unplanned pregnancy and teen motherhood. One study in Sweden showed 15% of females with ADHD were teen mothers, compared with 3% of a comparison group. So that low self-esteem, really triggered by those feelings of failure, can really exacerbate their looking for these relationships and love in other places. They're more likely to have self-harm behaviors, problems with body image, eating habits, school confidence, romantic relationships, close friendships all lead to self-harm. And then their employment challenges and that long-term anxiety and depression. And like we talked about, they have all kinds of strengths that we really want to be able to tap into. They tend to be very creative, more adventurous, highly perceptive and imaginative, very passionate and energetic about the things they love. They can get into that state of hyper-focus or flow, and it can really help them see big picture and multiple points of view. And they're really good at brainstorming because of the fluidity of their ideas. So before we go into this slide, well, I was going to ask you all, but here are all the answers. If you all have any ideas for how you might see this in education and what you might do to support girls better who have ADHD. Anything we could do to better identify, understand, and support them. And I have a few ideas here, but. Anybody?
I mean, I think definitely for teachers, especially for the general education teachers who are not as aware, right, of how ADHD might look in a girl. And I just so relate to it, because although this was many years ago, but you're talking about my sister. Absolutely. She was that child. She's quiet. She was never disruptive or anything like that, but she was constantly daydreaming. Again, many years ago, her teacher said to my mother that my sister was physically present but mentally absent. Something we would never say today, but she was always that, and constantly failing grades. And everybody was like, I don't know. She's just so quiet. She's so nice, so, and just getting teachers, to recognize that that's not a nice child who's just trying her best, but somehow isn't, passing her grades. It's something else.
Yeah. I love that. Well, I'll just run through these really quickly, and if anyone else has a comment or a question about these, you can let me know. But we really, like you said, need to work on that educator training just around the bias we have and what we're looking for, as well as the rating scales, because research does show that teachers will give lower rating scales than parents on hyperactivity symptoms in girls. And that's sort of why we have some of that rating bias, And so that's why partnering with parents is really helpful. So if a parent is coming and saying, this is what's happening at home, it's sometimes kids are holding it together all day at school, right? And then they're getting home and these things are coming out. And so sometimes it's just important to have that full circle of communication. And then, really thinking about teaching scaffolding and executive function strategies to everyone, because we won't know who all the kids are in the class that will benefit from those. And so sometimes we find, it's hard to be intentional about those because we think kids at a certain developmental level will all have some of that, but they really don't. So that's why some of that's really important, and why universal design for learning is so important, because we really don't know what we're seeing in the classroom a lot of the time, right? There's a lot of kids who have challenges that we can't see. I'm very much this week into don't judge a book by its cover. Sometimes we just don't know what's really going on with a kid. Really important to pay attention during the times of transition from elementary to middle and middle to high, because a lot of that scaffolding goes away. Even K3 to 4 or 5, we can see a lot of the scaffolding goes away, and we just need to really pay attention during those times and make sure those kids who really need that support in learning the new expected skills have them. And then really keep your eye out for those compensatory strategies. Are there things that the girls might be doing to kind of maintain themselves? Are they shaking their legs a lot? What are they doing? Are they looking out of the window? Just looking for those things that they may be doing to mask, and really focusing on our SEL interventions is so important, because these kids need more resilience to get through. And it's so important we give them a chance to succeed. There was a 2020 study by Fuller Thompson that found among all people with ADHD, those who completed post-secondary education were 64% less likely to attempt suicide than those who didn't graduate from high school. And so we need to get these girls on a path, a long-term path to success. And 1 in 4 women with ADHD have attempted suicide, which is much higher than the average. So we need to do that work. There are a lot of successful women who have ADHD, and these are just a few of them here. So we know that if we set women on a course and give them the support they need, they can just do such amazing things. So as we start to think about them down the road, Abby, the next slide, please. There's so many different ways that women with ADHD can be successful. They can do anything that they want if they have a passion for it, because they have this hyper focus and this ability. So, teacher, journalist, entrepreneur, artist, writer, anything that engages them in being actively engaged with new situations, right? And a lot of times we see the ability to handle emergencies, because they can sometimes respond more quickly. If they can be physically involved, if they can do multiple different things in a short period of time, be really creative. There's just all kinds of things that they can do. So we really encourage educators working with girls with ADHD to help encourage them to find things they love and are passionate about. Anything that lets them be creative and utilize whatever their unique strengths are. And then if they have weaknesses, let's introduce them to assistive technology that can really help them, take that burden off of their minds so they can really focus on what they're great at. So we have a few resources. These are the ones I would say, like if you were looking for resources, are the best ones to go to on ADHD and female. These are in the there's a handout, and we also posted our slides. So if you don't want to write them all down, or you can take a picture of the screen, whatever works better for you. Divergent Mind by Janara Narenberg is a great book about a woman who learns about her neurodivergence. Different Not Less is by Australian actress Chloe Hayden, who I think is autistic, ADHD, and dyslexic. She's amazing. And then Young Women with ADHD by Rose Saracina. And then online, you can follow Danny Donovan, those ADHD comics, or Jessa McCabe on YouTube. She does How to ADHD. And then Duke has a Center for Girls and Women with ADHD. And so just leveraging social media to learn about the lived experiences of females with ADHD can be so powerful and can be shared with students and families to help everyone understand what's happening. And so we already talked about a girl like this, Sandra, I hope I say your name right, Sandra, explained about her sister. I don't know if anyone else knows a girl like this or has any thoughts or questions at this point before we shift gears to talk about autism.
I mean,
Okay.
for me, I have ADHD and was not diagnosed growing up, right? And a lot of like the internal stuff that you were talking about, right? So yes, I was diagnosed with depression and anxiety very early on. It wasn't until I had my son who went through, you know, and he was diagnosed in 3rd grade with ADHD, and I started digging and learning more, and I'm like, oh my gosh, like this is all stuff I experienced internally, and now that I'm older, it's actually starting to manifest externally, right? Really interesting. But now I have also a daughter, younger daughter, who I'm like seeing very similar characteristics, right? But now I'm like ahead of the game, and now I'm able to see this. But it's really fascinating how, yeah, a lot of the things, right? Like all of the social emotional stuff that you talked about, that I was like, oh my gosh, I'm not good enough. It's all me. I should have it together. I should be right. Like all of that stuff is very, very real.
Thank you so much for sharing with that with us. I mean, I know that can take a lot of bravery to share publicly. So thank you for sharing your experience. I'm glad you're doing the work you're doing, right? You finding ways to include more kids. So we don't need to go through our example today because it's there if you need it and you want to refer to it. Okay, so next up, we're going to be talking about being autistic and female. And a common statistic highlights that 4 females are diagnosed with autism for every 1 diagnosed female, but researchers believe the true ratio may be closer to 3 males for every 1 female. And if you look at autistics that have the most severe support needs, the ratio actually is closer to 2 to 1. So the discrepancy in diagnosis is actually much more pronounced in girls who actually don't have an intellectual disability. We see this a lot, that girls are missed because the original research by Kanner and Asperger was conducted exclusively on male subjects. And it was what was used to create those diagnostic criteria. And the female phenotype, so a female or internalizing phenotype, really does present more subtly. So there are also the media portrayals of autistic characters such as Raymond and Rain Man or Sheldon on the Big Bang Theory, and those serve to reinforce those sort of very male-oriented conceptions. Keep going back, Abby. One thing that's really important to note too is that not only are female autistics less likely to be diagnosed, they actually are diagnosed on average 3 years after male autistics. And it often doesn't come up until we start to see attention and learning related challenges in school. And that's when we start to say something is going on with this child. So those young girls are really missing out on those important services and supports that could help them understand their needs well. And also, they just aren't able to sort of start integrating this into their identity from a young age. So we do see a growing body of voices and books and blogs and videos from women who were diagnosed in their late teens and even further into adulthood. And it's just that the problem is the girls have to go through several rounds of usually burnout and panic attacks in order for anyone to actually start to take seriously what they're seeing. And so we know from research done in 2018 that, you know, our diagnostic procedures really don't identify females, especially if they have a higher intellectual ability. It's their intellectual ability is masking or confusing the people around them because of what we expect to see. So there are some differences between autistic males and females, or the externalizing and internalizing presentation. Now, all autistics in the United States have to meet certain criteria according to the DSM-5, right? They have to have challenges with social communication interaction. They have to have repetitive and restrictive behaviors or interests. It needs to have occurred early in the developmental period, needs to have a clinically significant impairment on them in their day-to-day functioning, and it can't be better explained by intellectual disability or a global developmental delay. But what we see with our girls in terms of being autistic is they actually have a higher interest in social areas than we expect them to have. A lot of them have a deeper drive for friendship. They're really trying to make friends. They have better linguistic abilities than we're expecting and better imaginative play. And they may have less restricted repetitive behaviors and interests, or they might just be very different. Because they might actually not be interested in things like, planes or trains or mechanical things, but more interested in things like horses, ferries. They go deep on their interests, but their interests look a little more typical. And all of this really leads to a lot of masking and camouflaging, and that's a large emotional price tag. And that's really what we see contributing to this misdiagnosis. In fact, there's some research that shows autistic girls present a little more like neurotypical boys, like their social skills, their motivation, their language use is more like a neurotypical boy than it is like either an autistic male or a neurotypical female. But it still sort of looks kind of in the range of what we're expecting, or not so far out of the range that we suspect something is happening. And so Dean et al. In 2016, in an article called The Art of Camouflage, really said if you're looking for social isolation on the playground, then you're really going to leave out a lot of autistic girls, because a lot of times they're weaving in and out of those social interactions. They may not be really establishing friendships, but they'll be more likely to hang around by the playground, kind of look like they're doing things, whereas an autistic boy might be more likely to circle around on his own. So there are a lot of challenges that are experienced by autistic females. Again, we've talked about this several times, but probably can't be said enough that they tend to internalize their emotions. So there's a lot more anxiety going on than sort of acting out. You know, they're less likely to be the one who's going to be throwing the books in the back of the classroom and more likely holding it in. That misdiagnosis and misdiagnosis is really challenging. A lot of anxiety and depression and eating disorders, or things that look like eating disorders just because of food sensitivities. They tend to have more empathic disequilibrium, which means that they're actually overwhelmed by other people's emotions. So there can be this common myth that autistic people don't have empathy, which is actually not actually true. They may have more cognitive empathy than affective empathy, but with some of these female presenting autistics, they actually are overwhelmed by all the emotions in a room. They can walk in a room and feel everyone's emotions, and that can be really overwhelming. This leads to more self-injurious behaviors and self-injury. So skin picking and hair pulling are more common repetitive behaviors among girls than boys. And they do have a much stronger increased risk of mortality by suicide. A 2016 study showed that is one of the things that make female autistic or die early mortality is from suicide more than male autistics. We actually had a Stanford student who wrote a blog post for us about her experiences pre and post diagnosis. She wasn't diagnosed until after she left high school, but they didn't know why. So they took her out in the spring of 11th grade and sent her to residential treatment, and she spent 5 months there. And it was just the first in a variety of hospitals and treatment where they just tried to figure out what was going on with her, and she baffled everyone around her. And she went on to say that when she finished high school, she spent another year in hospitals, and that was when she got her autism diagnosis. It took almost 2 years of actually being looked at by professionals to understand what was going on with her. And it really helped her contextualize everything. It gave her a framework to understand her behaviors and how her mind worked. And it really gave her the confidence to make better decisions for her. So I think it just goes to that point that it's so important we help these children understand who they are, because they spend a lot of time doing self-injurious things otherwise. And our autistic kids have a lot of strengths, whether they're male or female or something in between, or gender journeying to figure it out. They have such passionate interests that can always be so interesting, and they really perceive details in unique ways. A lot of them are really great at pattern finding. Some of them have amazing memories, and some of them really have a very strong visual, spatial, and design-oriented thinking. Our girls tend to have these passions that are less esoteric and object-oriented and more stereotypically girl-oriented. So books and fashion and fairies. And so they're blending in a little more, like I said before. But there's just, they have all these strengths. And so we really should be looking for those and helping them see what they can do with them. So curious, these are some ideas I have about the implications for K-12. Does anyone else have anything they want to share, based on what we've covered? Any implications that you can think of? You can say it out loud or put it in the chat.
I guess at my school with this particular student, it's kind of hard for the general ed teacher to understand that she potentially could be autistic, because she doesn't fit the normal of what we study and what we've seen. And so just trying to remind her and keep an open mind. So I get a lot of it's just having the teacher keep an open mind and not just passing judgment based on what we know of how men or boys are diagnosed versus how females are, because there's not a lot of support and there's not a lot of research. And so she's like, well, she doesn't act like so-and-so, referring to a male. And it's like, well, because she's not male and it's differently. So just kind of educating teachers on how it's presented with females is a huge part of that. And social skills, that's also another area of need for this student. Is she does fit in. She's very girly. She always has a unicorn shirt with the bows on it. Everything's very on trend for what girls her age are wearing and what they're doing, but she has a hard time making those connections. She feels like everyone doesn't like her. No one wants to be her friend, when in fact, there's a lot of people that want to be her friend. She just has a hard time navigating when they don't want to do what she wants to do. So just kind of finding ways to teach that to others and kind of help them just be more aware of what her needs are as a student with autism, as a female.
Thank you for sharing that. And I hope we'll connect. And I live in Palo Alto, so if there's any way I can support the family or the teacher or you in your work, please let me know, because that's also spot on. And a lot of times with these girls, these things come to a fore in middle school when the social dynamics really change. And then all of a sudden everyone's like, oh, she's been having these challenges all along, but we didn't know what they looked like,
Yeah, I have a similar, my friend's daughter, I'm kind of on the fence. I think she is as well. She has a lot of these same, especially with social skills and navigating her friend groups, and doesn't really know how to solve any of the challenges that she's having with a friend group. She'll just leave them and go find somebody else instead of talking it out and learning how to navigate that space. She just freezes in the moment and just walks away.
Yeah. And of course, with COVID,
yes, that didn't help. Yes, that did not help either.
Doesn't help, but yeah. Well, child find. I think that's something you're talking about right here is, we have the obligation to look for these kids, and sometimes it's these more subtle presentations. And so just remembering our obligation to find these kids. And I think, Tristan, it sounds like you're doing amazing work to help people navigate that. So thank you. And then there is a hidden curriculum that we maybe just need to be more explicit about with, and it could be we need to be more explicit with more kids now because of COVID. A lot of kids miss some of this development, but our autistic kids in particular, they do need support with social skills as long as it's not like ABA oriented. I mean, it needs to be done in like a very neurodivergent, affirming way. We need to think about how are we really building their self-esteem, you know, because it's easy for them not to feel good about themselves, as well as those self-advocacy skills. We talk about this a lot, that a lot of times kids get to middle school and we're like, oh, I want you to self-advocate. Everybody should be self-advocating now, that like no one knows what that really means or how to teach it or how to scaffold it. So it's these kids in particular, they need to know who they are, what works for them so that they can self-advocate, because it's really important. They can be subject to a lot of trauma later in life because they've not learned how to speak up for themselves. And then just being as strengths-based as possible. And these are all those kind of hidden things that aren't part of like the main reading, writing, social studies, science, right? But that undergird everything. And then again, that transition planning, especially from high school to college or a job, right? Like we need to be doing a much better job on helping these kids transition from one phase of life to the next. But because these kids really have a lot they can offer. They can bring a lot of strengths in the workplace, and they do face challenges too, based on, you know, years of not feeling that they don't fit in. But in a workplace, they might notice things others might miss. They tend to be very loyal and committed workers, very persistent with a strong work ethic, quite diligent. They can be very thoughtful and empathetic because they've gone through a lot themselves. So they can really, you know, have a lot in their hearts for other people. They tend to be very invested in diversity and wanting everyone to be included, and can have really innovative and creative ways of looking at things. But of course, they might not have that confidence to be assertive and really advocate for their needs. The social non-work related elements can be difficult, like water cooler banter. And this can be even harder for girls because we expect girls and women to have stronger communication or to be nice or to be the good girl. And so a lot of times that's really tough. And those personal issues in the workplace can really overwhelm our girls and young women. Sounds, lights, sensory triggers that they have. And job interviews can be really difficult because of so many unwritten rules and expectations. So we need to be very thoughtful about how we're preparing our K-12 girls to go out into the world and contribute their immense talents, because they really can pursue a wide array of careers based on their strengths and interests. And it really is about looking for that dovetail between their passions and the careers that are available. There's really almost nothing that they can't do if they really want to. And the next slide shows a quote from an autistic student at UC Davis, Lisa Malins, who's going into bioinformatics. And she just talks about how you need to find a fulfilling career and be able to connect with people. And that is not unattainable for autistic people. And you can really use your autism to your advantage through your intense interests, because they bring you a lot of joy, and that passion creates more passion. So the next slide just shows some different autistic women have thriving careers doing very meaningful work that leverages their talents and interests, from advocacy and research to astrophysics, teaching, graphic design, veterinary medicine. You know, these are autistic women who are pursuing work that is very purposeful for them and beneficial for all of us. So just to kind of wrap it up, we've talked about this, really, you know, teaching them to self-advocate, working with their strengths. Really important to encourage college if they're capable of doing that, if they want to do it, if they're interested in doing it, because there is some research that shows if they can get to college, their outcomes are a lot better. We have to always be aware that autism has a very strong sensory component to it in terms of how they're processing sensory information. And we may not see that. We may not know that the rug is itchy, or that they can hear the water dripping in the back of the classroom, or that child over there humming is something they cannot tune out. So we just need to make sure that we're always aware of that and have a sensory plan in place. Working with a therapist is really important for autistic girls and women, and really just to be connected with other autistic women is so important. There are several groups, Autistic Women's Association, the Yellow Ladybugs, the Autistic Women and Non-Binary Network. It's easy to Google and find some of these organizations. So we do also have some resources here. Yellow Ladybugs is a group out of Australia. They just came out with a book called Supporting Autistic Girls and Gender Diverse Youth that I highly recommend. There's a new book also that came out this year. I don't have it on here. It's called, I'll find it while Abby is talking. It's called Is This Autism by Donna Henderson and Sarah Wayland and Janelle White. That's a great book for really summarizing all of this. And then there are a couple of fiction books that I think are really good. One for younger readers, A Kind of Spark by Elle McNichol, that also is a TV show. And then The State of Grace is about a 15-year-old autistic girl. And they're really good about just getting you right into their minds. And then lots of different online resources, and I've listed those here. Any other thoughts or questions before we move on? Okay, I know we need to keep moving, but this is just another example of an autistic girl, and I'll let you all review that on your own. But sometimes it's those really, really quiet girls who aren't communicating with anyone and causing no trouble at all that really get missed until they're 14 or 15. So that's this young lady that I know personally. So, all right, I'll turn it over to you, Abby.
Great, thank you, Callie. Okay, and so now we're going to shift gears and talk a little bit about what it means to be dyslexic and female. So we'll start by just making sure, we're all on the same page with the definition of dyslexia. Dyslexia is often, you might see it written on various IEPs or other documents as a specific learning disability. When that's written, they're referring to dyslexia. This is a challenge with reading, both in your pace, your speed of reading, your prosody, and your accuracy. And these challenges can be the results of deficits in actually two distinct ways. So in rapid automatic naming, which is that ability for the brain to like retrieve the information so that then they can vocalize or comprehend the symbols they're seeing on a page. And it can also be a challenge or a struggle with phonemic awareness. And again, that's understanding how to hear, identify, and manipulate the phonemes, which are the elements of like the letters in the words. And this is the dyslexia diagnosis is often accompanied by other challenges such as dysgraphia. Dysgraphia is a challenge with handwriting, or dyscalculia, which is a challenge with number sense or math. In fact, so often that some research suggests that the co-occurrence of these, dyslexia and dysgraphia, dyslexia and dyscalculia is often appearing to be kind of the rule rather than the exception. You'll frequently see a child with dyslexia who has one or the other of those additional diagnoses. And some interesting data about that male-female discrepancy. So more males are dyslexic when we look at reading deficits. So factually, when we study males and females, we see that statistically, males do struggle more than females when it comes to reading, and those rates are higher. And so there are several studies that show that even across countries and across cultures, girls do in fact read with greater skill and accuracy. So in fact, it looks to be research showing that dyslexia is even 2 to 3 times more prevalent in males than in females. So what are some of the reasons for this discrepancy? This is really, really fascinating. When at first, some of the early studies before 2014, as we've sort of talked about in some of our other, like in autism and ADHD, most studies with dyslexia were focused on males. But after 2014, they kind of realized this was the situation and started focusing on making sure they included girls in their research. And they started to look at, so for instance, in 2014, a researcher ran a large scale MRI study where he looked at dyslexic males and dyslexic females and looked at what areas of the brain had more gray matter, which was indicating where things were lighting up and where challenges were, where things weren't lighting up. And they found there were actually structural differences in male and female dyslexic brains. So the boys had more anatomical aberrations in the left hemisphere, which is brain regions that support language. And so they had less of that gray matter in those areas, where girls with dyslexia had less of that gray matter in the right precentral areas and some other areas in lots of detail here that involve not the language challenges, but actually sensory and motor processing challenges. So we diagnose the results, if you will, as dyslexia, right, for both males and females, but statistically, and it's of course we've mentioned it's not 100%. You'll see males who have sensory and motor processing. You'll see females who have rapid automatic naming deficiencies. But in fact, what we are seeing is an actual difference in how the brain is challenged, kind of resulting in a same presentation. And so what we are starting to see is that processing speed is what really causes the difference. So males much more typically have slow processing speed, and that is a less common occurrence for women. And there doesn't seem to be a difference, male or female, on phonemic awareness challenges or working memory. But that processing speed is a key addition that occurs more often in males, which is why we're seeing more males with dyslexia. So some interesting implications of this. I think when it's factually true that there are more males who are dyslexic than there are females, then the result of that is that we're all used to expecting dyslexia in males, and we aren't really looking for it as often in females because it's just not as common. And so we just may be conditioned to be looking for those female dyslexics. You know, that doesn't come to our mind right away when we see a girl who's struggling to read. And another thing that we should always keep in mind is if we see sensory challenges or motor processing challenges, especially alongside some challenges with reading, we should definitely consider those indicators that a female should be screened for dyslexia. Because that female dyslexia presentation is going to be more subtle. Again, because they're not as challenged with their processing speed, their challenges are going to look a little bit less drastic than the males who are having these challenges. And additionally, as we know, females often react to challenges internally, as we've talked about many times this presentation. They're internalizing their challenges, so they may naturally work harder, become more focused, and become more studious in order to make up that gap, whereas a male with dyslexia may externalize those things with humor or disruptive behavior. And again, those internalizing behaviors the females are doing to compensate make it more difficult for us to notice the challenges that they may be having and that they need extra support. Now, we know that dyslexics have many strengths. They're excellent communicators, they're excellent leaders, they're often very creative thinkers. I have some interesting examples when we look at some of the notable famous dyslexics, but they often have a heightened ability to perceive information in peripheral vision or other really subtle differences in like a field of complicated imagery that they can pick up on that other people cannot or have more challenge doing. They're often really excellent at that big picture strategic thinking and really describe themselves as non-linear thinkers. And I think that's where that big picture holistic thinking comes in. Just like everything is kind of happening at once, they've got a real great sense of the whole picture, and they can draw really interesting connections and conclusions between all sorts of things that others don't necessarily see the relationship between. Yes, and as promised, yes, we have many dyslexic women's success stories. We have Octavia Butler, a very successful science fiction author, and I think that she really worked. Her grit and her resilience is so notable, and you can see it in her own journals that she wrote. And again, I think that she just had to work doubly hard, and she challenged herself to work doubly as hard as others in order to be the success that she knew she could be. And, a lot of that comes from that internalizing behavior that she was using to overcome some of her early dyslexia challenges. Carol Greiter, who won a Nobel Prize, but in fact, she has told people that she had difficulty even getting accepted into college due to her discrepancy between her standardized test scores and the grades she was getting in classes she was really passionate about. So it was really only certain teachers who were able to overlook those standardized test scores and see her brilliance that enabled her to, get as far as she had. I mean, like I said, she won a Nobel Prize. So very, very successful dyslexic individual. Beryl Benecraft, she's the woman I was referring to earlier, a very successful radiologist who credits her dyslexia. She says because of it, she's able to see little discrepancies in radiology images that other colleagues of hers don't pick up on as readily as she does. And many other, we have a successful writer here. We have a successful senator. The Senator Carol Moseley Braun quote says she credits her discipline, the expectation that she needed to work harder than others, and that it helped her find her courage, and that really what she credits for her success. And Wendy Wasserstein, who is a writer, and again, you often don't think of dyslexics as becoming writers, but they do have exceptional creativity. And she actually said, in some ways, being dyslexic is a gift because it helps you think less linearly. So some strategies for our dyslexics. I think we've talked about this. One of the things that doesn't fit on this slide here is that, creative, perceptive, passionate dyslexic individuals can become these things. Well, they can become anything. So that's a little part that got left off the slide. Dyslexic women are everywhere. Neurodivergent women are everywhere. It all has to do with the convergence of their passions, supportive community, and helping them, do more of what they're good at. So some tips we can offer our dyslexic females is to make sure to delegate. So don't be afraid to ask for help. Speak up if you're needing extra support. And so, for instance, you might have someone else take notes for you, so that because that's not an area of strength and it distracts from your concentration. To make sure to encourage that they do use assistive technologies, dictation tools, text-to-speech, assisted reading, and again, always look for those careers that are going to emphasize their strengths and passions. I think there were a number of other books, but I'm not sure why they're not coming up on this slide. But Fish in a Tree is a wonderful fiction story about a dyslexic girl. And I also always recommend The Dyslexic Advantage by the Brocks. Wonderful book talking about all of the positive elements of dyslexia. And many of the famous individuals I spoke about who are dyslexic came from this wonderful resource online at the Yale Center for Creativity and Dyslexia. And there are many other profiles of female dyslexic and all sorts of dyslexic individuals and their success stories.
Abby, I put the others that should be on the slide in the chat.
Okay, great. Thank you. So I thought I would pause for a minute and, ask you guys if any of you know girls like this, girls who are dyslexic and maybe it's a little more subtle than their male dyslexic peers.
Me, I'm dyslexic. Yeah. So I love learning about it now that I've processed the trauma due to dyslexia and all that stuff in the school system. It's kind of nice to learn more about it and see just it's not me. It's just part of me, so it's really nice to hear more about it and just be painted in more of a positive light.
Yes, thank you. That's really well said, really beautiful. And I know my daughter is dyslexic and also has ADHD, and so it's just always interesting to hear us, all talk about all of the strengths that they, that they have, and see these presentations, some of her more daydreamy behavior, and also her challenges with writing and spelling, and yet she loves writing. And is actually quite a gifted storyteller. So it's just really fascinating to see these girls and how they are, existing in the world, and succeeding. And thank you for that story. I do have one little example of a girl. This is a profile of a child that I know, who's a 7th grader, and she's just extremely brilliant, dancer, choreographer, very artistic and creative, but she's quite bored and disengaged in school, and she doesn't really complete writing assignments. And yet when she decided one day that she wanted to write a play and then get her classmates to act in the play, and then they were going to produce it and put it on, her mother told me that she stayed up all night writing this play. I mean, she wrote like 60 pages of play. And so I think that this is just a great example of a student who, but it doesn't mean that the next day she went back and wrote an essay on World War II, but it does mean that she can write when motivated and when put in an area of interest and passion. And that's what we really want to find for all of our children. And that really brings me to our final conclusion, which is a little bit about bringing everything together. So this is a great quote from Meryl Davis, a very gold medalist Olympian, saying, what you want to do is be patient with yourself. And just because things come differently to you doesn't really make you any less, right? We all know this, but it's always good to remember. You just rely on people who are there for you, and you have confidence in yourself. And so, how can we do this in the classroom? We can provide for all of our neurodivergent students opportunities for individuals to know and show and really grow those strengths. So more than just finding out what they are, finding ways to integrate them meaningfully into every element of curriculum and classroom. And this is another really great quote from Nancy Brinker. And she says, your path may be different. And she's speaking to these neurodivergent individuals, say, your path may be different, but it doesn't mean it'll be bad. You don't need to be discouraged because you're a round peg and you don't fit in that square hole, but you will find the place you fit by doing what you love. And as long as that you find out what that is and you focus on it, you'll have passion, you'll have success, and you'll find joy and fulfillment in life. Now, one of the things I do want to talk a little bit about briefly is some of the additional confounding factors that can make it even more challenging to identify our neurodivergent females. So the first is co-occurrence. So we have lots of research that shows, for instance, ADHD co-occurs with other psychological conditions, frequently with autism, but also with dyslexia, and others that we haven't really talked about, like possible mood disorders, anxiety, etc. And these things can often then end up, conflicting one another. People aren't sure which diagnosis is the right one, or you might get one first and then only find out later that a different one applies. In fact, also with students who have quite high abilities, even that can be kind of confused and cloud the picture when we're trying to understand the profile of the child we're looking at. As Callie mentioned, students who are gender exploring and trans, that can also, be another element in the mix. There is some recent research I was looking at that Callie sent me about how it may be true that there is a higher percentage of trans students who are autistic. So that there is some co-occurrence of those conditions. And so again, further complicating us understanding and untangling what's going on with these individuals. We know that culturally, linguistically, and economically diverse students are often misdiagnosed. So people attribute their challenges often to other things rather than, external factors, et cetera, rather than really looking for those root causes. And again, often their deficits are focused on much more heavily than their strengths, which is just really a shame and makes all of this more challenging. And then we also have individuals who are augmented and alternative communicators, again, further confounding and challenging our diagnoses. But I do want to leave you all with this quote by Dr. Yang Zhao. And what he's saying is to remember that all human beings, regardless, male, female, neurodivergent, neurotypical, children and adults alike, we all have the potential to be great in our own unique way, and they need that. They need that for their lives. And so in order to be happy, psychologically healthy, and a strong sense of self-worth, it's important for us to take the time to understand ourselves, understand our students, understand our children in the best way that we can, and always work to do better and improve and find those passions and support them. So we just want to leave you in these last few minutes with the request, with the question to say, you know, what commitment can you make after learning all of this today? And you could have a low commitment, like you could follow one of our neurodivergent females we recommended to you on social media. You could have a medium commitment, like hosting a book club in your community with one of the books that we've mentioned, or even perhaps a high commitment, like creating a professional learning community on a neurodivergent females at your school site. So we would love to hear from you. I think we had another one of these activities where you could do that, but since we're such a small group, if you want to speak out or you want to type it in the chat, if there's something that a commitment that you would like to make towards making a difference for your female students, please let us know. We would love to hear it.
I think this is a great topic for me to talk about during one of our I'm on an inclusion committee at our school, and we're planning on doing some type of presentation. We're still working on the logistics of it, but I think this is an important topic to talk about because there's a lot of females at our school that we're just kind of not knowing or unsure how to support. And I think with just kind of calling or bringing some of these things to their attention, we can kind of start getting them the supports that they need instead of just kind of letting them figure out life on their own and unnecessarily struggle.
Yeah, that's great. Thank you.
And if there's any way we can support you in that, let us know. Please do reach out.